5 signs. 5 specific warning signals that your penis might be giving you right now, indicating that your sexual potency is diminishing or is seriously at risk. Often, our body communicates with us. It sends us clear signals that something isn't functioning quite right. When it comes to men's health, and specifically sexual health, the penis acts as a barometer. It is frequently the canary in the coal mine for the rest of your body. Long before you have a heart attack or a major systemic failure, your reproductive organ may start showing subtle alterations. Through small, daily changes, things you might dismiss as just having a bad day or simply getting older, your body is trying to tell you that your physiology is compromised. If you identify with at least one of these 5 symptoms or signs that I am going to detail today, take it as a serious alert. Do not ignore it. These are not things that generally resolve on their own without intervention. Let's get straight into it. Here are the 5 situations you need to watch out for. Number 1 involves the disappearance of spontaneous erections. I am talking about those involuntary erections that occur without you thinking about sex, without you touching yourself, and without any visual stimulus. These happen primarily while you are sleeping and right when you wake up in the morning. We call these nocturnal penile tumescence. These are distinct from the erections you get when you are intimate with a partner. These involuntary erections are the most physiological, natural erections a man has. They occur during the REM phase of sleep. During this deep sleep cycle, your body releases a surge of testosterone and triggers the release of nitric oxide. Nitric oxide is the most critical molecule for your sexual health. It is the primary vasodilator that tells your blood vessels to open up and allow blood to rush in. Think of these nightly erections as a maintenance mechanism. It is your body's way of oxygenating the penile tissue. It keeps the internal structures healthy, elastic, and functional. A healthy man, regardless of age, should typically experience 3 to 5 of these erections every single night. Consequently, it is very common and healthy to wake up with an erection, especially if you have a full bladder, which stimulates the nerves in that area. Now, here's the warning sign. If this has stopped happening, pay close attention. If you cannot remember the last time you woke up with an erection, or if the frequency of these events has dropped drastically, this is not just a standard part of aging. It is a biological alarm. It is a strong indication that your hormonal health, specifically your testosterone production, may be faltering. Even more critically, it points to your vascular health. It suggests that the blood vessels are struggling to dilate properly, or that the nerve signals aren't getting through efficiently. If the mechanism isn't working when you are asleep and relaxed, it is going to have a much harder time working when you are awake and under pressure. Number 2 is observing structural changes in the penis itself. This refers to alterations in the appearance, feel, and dimensions of the organ, particularly when it is in a flaccid or soft state. You might notice a loss of elasticity. The tissue feels less like a firm sponge and more like it has lost its life. Some men describe it as looking more shriveled or retracted than usual. You might have the distinct impression that you have lost length, or that the penis is retracting inward into the body. This is often associated with 2 things, hormonal deficiency and what we call disuse atrophy. The old saying, use it or lose it, actually has scientific merit here. If tissues aren't being oxygenated regularly through erections, they can begin to atrophy and fibrose. Beyond just the look, pay attention to the texture during an erection. A very specific and concerning sign is uneven rigidity. This happens when you are engaged in sexual activity and you notice that the base of the penis is hard, but the tip, the glans, is soft. Or the reverse. The tip is engorged, but the base feels unstable and rubbery. This disparity in hardness suggests an alteration in the structure of the corpora cavernosa, the twin chambers that fill with blood. It usually points to the development of fibrosis, essentially internal scar tissue. This scar tissue is not elastic. It doesn't stretch. So, when blood rushes in, the healthy tissue expands, but the scarred tissue does not. This condition is often a precursor to Peyronie's disease, which involves curvature of the penis. But before the curve appears, you often get these structural warnings: a loss of length, a loss of girth, or unstable, unequal hardness. If you feel hard lumps or plaques under the skin, that is fibrosis, and it is a direct threat to your future potency. Number 3 is what I call the roller coaster of performance. This is the oscillation of sexual capability. Many men come to realize something is wrong when their sex life becomes unpredictable. One day, everything works perfectly. The erection is strong, it lasts, and the performance is a 10 out of 10. But then, a few days later, under similar circumstances, you experience total failure. You cannot get an erection, or it is extremely weak. Then, a week later, it works again. This cycle repeats. The reality is that erectile dysfunction is rarely a straight line down. It is a cyclical disease with peaks and valleys. Because it is inconsistent, many men dismiss it. They blame it on being tired, having a stressful week at work, or having too much to drink. And while those factors matter, a consistent pattern of inconsistency is a medical red flag. It is normal to have an occasional off day. It is not normal to feel like you are gambling every time you initiate intimacy. This oscillation usually indicates that your cardiovascular or hormonal systems are teetering on the edge. You are borderline. On days when you are well rested and your stress is low, your body can just barely cross the threshold required to maintain an erection. On days when your system is slightly taxed, you fall below that threshold and nothing happens. If you are experiencing this unpredictability, it is a sign that your vascular reserve is low. Your body is struggling to maintain homeostasis. Do not wait for the good days to disappear completely before seeking help. The earlier you catch this oscillation, the easier it is to stabilize. Number 4 involves the inability to maintain an erection, often referred to as the gas leak. In this scenario, the patient reports that starting is not the problem. You can get an erection. When things heat up, blood flows in and you get hard. But then, very quickly, you lose turgidity. You might be in the middle of the act, or perhaps you change positions, and suddenly the erection fades. You lose the hardness required to penetrate or to continue. Consequently, you cannot reach orgasm or ejaculate because the erection subsides before you get there. This is a classic sign of what we call a venous leak. To understand this, think of your penis like a bathtub. To fill the bathtub, you turn on the faucet. That's your arteries bringing blood in. To keep the bathtub full, you need to put the plug in the drain. That's your veins compressing to trap the blood inside. For a solid erection, the blood must flow in faster than it flows out, and it must be trapped there under pressure. In the case of a venous leak, the plug isn't sealing properly. The blood arrives efficiently, you get the initial erection, but the mechanism that traps the blood inside the corpora cavernosa is failing. The blood escapes back into the body through the veins just as fast as it enters. Why does this happen? It is usually because the smooth muscle tissue inside the penis, which should be elastic and relaxed to trap the blood, has been replaced by stiff collagen and fibrosis. Because the tissue is stiff, it cannot compress the veins against the outer wall of the penis effectively. This is a mechanical failure of the hydraulic system. It is frustrating because the desire is there, the initial response is there, but the endurance is gone. This condition often requires specific diagnostic testing, like a Doppler ultrasound, to confirm the rate of the leak and determine the best course of treatment, as simple pills often do not fix a severe leak. And finally, sign number 5, the medication stops working. This is the lack of response to the inadequate or habitual use of drugs like tadalafil or sildenafil. We see this frequently in patients who self-medicate. Perhaps you noticed some issues a few years ago, so you started taking a pill you got from a friend or bought online. At first, it worked like magic. It restored your confidence, and everything seemed fine. But over time, you notice the effect is waning. You take the same dose, but the erection isn't as firm. Or it takes longer to kick in. Or, in the worst-case scenario, you take the pill and absolutely nothing happens. Some men try to compensate by doubling or tripling the dose, which is dangerous and increases the risk of side effects without necessarily improving the erection. If you are in a situation where oral medications, which are powerful vasodilators, are no longer effective, this is a major sign of disease progression. It means that the underlying damage to your blood vessels and nerves has advanced to a point where simply chemically forcing the vessels to dilate is not enough. The tissue is too damaged, or the blood flow is too restricted for the medication to overcome the physical barriers. It indicates that your condition has moved from mild or moderate to severe. When the blue pill or the yellow pill stops working, it is not because you developed a tolerance to the drug in the traditional sense. It is because your pathology has worsened. At this stage, you need a professional evaluation to adjust the treatment protocol. This might involve different medications, injectable therapies, or other interventions. Continuing to just pop more pills is not the answer and can be risky. However, before you resign yourself to invasive injections or risky surgeries, there is a natural avenue you should investigate. There is a bizarrely simple, 7-second daily habit, often described as a purple hardening tonic, that targets the biological root cause of these failures, specifically clearing the oxidative rust and the boner killer, enzymes that pills can't fully fix. I have found a presentation that explains exactly how this home remedy works to naturally restore stiff, long-lasting erections without the side effects of pharmaceuticals. I strongly recommend you watch it. You can access it right now by pointing your phone's camera at the QR code appearing on your screen, or simply by clicking the link I have pinned at the top of the comments below. It's a game changer for reversing that disuse atrophy we talked about earlier. Check it out, and then let's recap what we've learned today. So, let's recap. The loss of spontaneous morning wood. Structural changes like shrinkage or uneven hardness. A roller coaster of inconsistent performance. The ability to get hard, but not stay hard. And finally, medication that used to work but no longer does. If you identified with even one of these 5 signs, your body is waving a red flag. It is telling you that your sexual potency is at risk, and more importantly, your general health needs attention. Remember, erectile function is heavily tied to cardiovascular health. Issues down there are often the first sign of issues with your heart, your blood sugar, or your hormone levels. Do not wait for a complete shutdown. The sooner you address these signs, the more options you have to restore your function and protect your longevity. Treat the root cause, whether it is hormonal, vascular, or lifestyle related, and you will often see the performance return. If this information was useful to you, please share it. There is a lot of silence and stigma around men's health, and sharing this could help someone who is struggling in silence to finally seek the help they need. Stay healthy, pay attention to the signs, and take care of yourself.